We call the Human Services Committee to order and begin with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The order of this meeting is the Department of Social Services. Mascarenas. Good morning, Mike.
Good morning, everybody. A couple quick things to report. I'm always, for those of you that don't know, I report a month behind on numbers because that's the way they roll into us. So what you're seeing on this month's report are yearly numbers for 2018. One thing we found interesting was 755 reports came into CPS this year, which was an all-time high. We've been talking about that every month. How our reports have been increasing and how our staff's been doing a really nice job keeping up with them. So I'm really proud of that. They did get a little less in December, so we're hoping that trend continues somewhat and that they can get their feet back under them. We also have 74 kids currently in foster care, which is also record high. When I took over 2 years ago, we had 38. So we've almost doubled in foster care. And just to give you a comparison, like Rensselaer County has approximately 130 people in foster care. So when you look at their population compared to ours, the numbers are pretty significant. That's all I have on the social services side, unless you have any questions about what I reported on.
Yes, Sean.
Mike, what's your hypothesis with rate rise in CPS cases and stuff?
I think it's a combination of things, to be quite honest with you. I mean, our demographics are what they are. We have a lot of haves and have-nots in our county. Poverty drives some of that, and simply educating parents on what they need to do in order to properly care for their children can be hard here. We don't have the services that other more populated areas have, whether it's a substance abuse issue or something of that nature. It can be very difficult to get people the help that they need to have a successful family. I think the drive in increased numbers really is around substance abuse and getting that help. We see our stays become increasingly longer. So our goal when we remove a kid is not to do that permanently. Your goal is to make the family be able to function at a higher level. But if you can't access the services to allow for that, you end up having longer stays, and it really just isn't any good for anybody, quite frankly. So for instance, we have St. Joe's here, but they're limited by what they can provide as well, just like everybody else. When you're in more populated counties, you can have daily meetings with AA and those types of things. Here that opportunity doesn't exist. A lot of these people are bound by transportation issues, so getting them from point A to point B is problematic. It's really a combination of things. Unfortunately, I wish there was one thing we could say just driving it. There's not any one thing. It's a combination of many factors.
Other questions for Mike? Yes, Tom?
Mike, I was questioned last week about EBT card. Is that what you call them?
Yeah.
Can you explain how they work? Because I'm hearing someone said they can go to a machine, get cash back out, and that kind of
No, that's not true even a little bit.
I didn't think it was, but I want it on the record.
Yeah, I appreciate your questions because, perceptions are what they are in terms of food stamps and EBT, but the facts just don't support any of that. Really, we determine eligibility here locally, but none of that money actually comes through our coffers, which is why we were so concerned, quite frankly, about the government shutdown. Because if the federal government shut down, all those payments stopped to individuals. But ultimately, we're responsible to make sure people have their basic needs met. So on a monthly basis, those cards, when they're determined eligible, they have cash put on them. A lot of it's really small amounts, to be quite honest, because it's based on an income scale. A lot of people get as little as $16 to $20 a month put on those cards. You're not going to take it to an ATM. You're not going to get money out on it that way. The items that are eligible, I will provide for the board, because I know I hear this one's buying here or this one's. It's simply not true. Those cards are really deemed to be specific for what the items are allowed. They're ran through just like you do your debit card on a machine at a store, and those items that qualify are put on the card. The ones that aren't, you have to have another mechanism to pay for. So no, that's simply not true. And I will get the board a listing of those eligible items for my next month's report. So I thank you for that question, because it gives me the opportunity to tell people the reality. Not that people are interested in listening, probably, but that is the reality of it.
Thank you.
Other questions for Mike? There being none, your resolution, please.
Yep. We have a resolution authorizing our stop DWI to contract with a prevention team in the amount of $6,000 to support the Arrive Alive tour. This resolution was approved by our DWI committee, and is really one-time incentive grant dollars from the state, so it's not coming out of our allocation that supports our local efforts. It's a grant allocation. We're going to offer 3 or 4 different dates to every school in the county, and what it really is it's different types of simulations: texting while driving, drunk driving. We're targeting the prompt ratio to hopefully have the most impact with students throughout the county.
And endorse this resolution by Mr. Monty, and a second by Mr. Marion. Any other questions or concerns? There being none, all those in favor?
Aye.
Opposed? Carried.
And I did this month attach the lifeguard flyer. Those have all been sent to all your school systems as well. Summer's kind of approaching rather rapidly. It'll be here before we know it. So we're trying to give those individuals the opportunity to be trained and be ready for your summer season. Other than that, that's all I got.
Other questions for Mike this morning? Thanks, Mike.
Thank you.
Next up, mental health, Terry Morris. Good morning, Terry.
Good morning. How's everybody doing today?
Very good.
So, I have 2 resolutions, and I'm going to step back and tell you a little bit about some things that are going on in our department. We would like to add Lori Kelly to the Community Services Board for a term of January 1st, 2019 to December 31st of 2020, and to also the Developmental Disabilities Subcommittee from January 1st, 2018 to December 31st of 2020.
An endorsement of this resolution by Mr. Giordano, and a second, please. By Mr. Marion. Questions, concerns?
Is it 2020 or 2022?
Sorry, 2022. Thank you.
All those in favor signify by saying aye.
Aye.
Opposed? Carried. Next.
And then the resolution to include Dr. Asghar Mehdi as a community services designee physician. And really what that means is that if someone enters their hospital and they feel like, you guys do these all the time, but you may not know why. So if somebody enters their hospital and they feel like this individual needs to be transported to a Article 39 hospital, which is a mental health hospital, they can do that. So they're acting as the fact that I can order pickup orders for those people that need to be observed by a hospital setting. That's what that's for.
An endorsement of this resolution by Mr. Jackson, and a second, please. By Mr. Marion. Questions or concerns? There being none, all those in favor signify by saying aye.
Aye.
Opposed? Carried.
So I just want to, the last time I was here, I sort of alerted you to some workforce challenges our department is experiencing, and now I have proof. So I was on a Department of Health website or report recently, and I learned that compared to Clinton and Franklin counties, and also the state average, that the state average for mental health providers in relation to number of population, the state average is 1 provider for every 390 residents. What I don't know is, does that include like individuals from my department and private providers? I think it does. I think it's like across the board. So state average is 1 in 390. Clinton County's state average is 1 in 400. Franklin County is 1 for every 440 people. Essex County is 1 in every 690. My department is down 3 clinicians right now. So not only are we down in our department with available clinicians, but we are grossly understaffed to provide the needs for the county. So I don't know if you remember me saying a couple months ago, like, I think we could use about 6 more clinicians, and just barely meeting the need in the county, and now I have proof. So I just wanted to bring that to your attention.
Mr. Monty?
Terry, now, you say you're down 3. Are those 3 positions that you can't fill?
One of the positions has been available since September. I continue to post, and I've interviewed 2 individuals that have jobs elsewhere, and our salary was not attractive enough to pull them over to us.
So there's a lot of factors involved here. It's not just lacking the conditions. There's reasons we're lacking.
There are additionally, I think, another factor that we kind of have no control over, we as a county have no control over, is that the rate of need of providers is increasing exponentially, but the rate of available providers is not. And there will be a huge shortage. They estimate that there will be a huge shortage for behavioral health providers, so substance abuse and mental health, from now until 2025, according to HRSA, Human Resources something Association.
What's the certification requirements?
Licensed mental health clinician, licensed master's degree social worker, licensed clinical social worker, RN, licensed marriage and family therapist.
And what's the salary that we are offering?
For first shot is about $47,000 a year. We only do we do an hourly rate, where our job is a 35-hour work week. So if I'm comparing to BHSN or Citizen Advocates, which does a 40-hour work week, I can't compete.
Mr. Monty?
What are the work weeks for the Clinton County Mental Health and Franklin County? Are they 35?
So Clinton County Mental Health is 35. They're at $51,000 a year.
Franklin?
Franklin does not have a mental health clinic in the same way that Clinton and Essex do. Citizen Advocates are contracted.
Other concerns? Thanks. Tom?
Do we receive any reimbursement for these positions? Through state, feds?
So the department receives some state funding, yes, and also as time goes by, honestly, that's probably going to decrease as we move into value-based payments, which we talked about, several months ago, but insurance is eventually going to pay the bills.
So the formula for that reimbursement is not, is it based on what we pay for the positions or no?
Is the
I guess what I'm
formula?
asking,
No, it's
if we were to increase the salary for those positions, would our reimbursement increase along with that?
no.
Okay.
I would, don't quote me on these numbers, but I would say about 60% of the people whom we serve have Medicaid insurance, which Medicaid and managed Medicaid, so like Fidelis and CDPHP, they're the best reimbursers. Private insurance, there's times I'm delivering services that Fidelis reimburses us at $133 per visit, and a private insurance pays us $24.
Mr. Mayor.
Thank you, Mr. Chairman. Terry was curious, what would be the average annual case of a caseworker? 100?
Can I answer that in a different way? So a full-time therapist, their caseload is about 50 to 60. Somebody who's just doing therapy, because we wear a lot of hats. Got one therapist out at the jail one day a week, one therapist that goes to drug court. So that's a tough question to answer. I've heard that BHSN, for example, their caseloads are up like 150. Now that doesn't. So kind of what I'm saying is that, and I know that they are behind on their billing. So there is a tipping point between like providing services and doing good quality work versus just churning out. Yep.
I was trying to get to the point of how we can get the numbers down from that 600 to 400. How many actual positions would address that specifically now? Which you're talking basically representing 4 positions.
Anecdotally, I'm going to say, and we could possibly feel like we're meeting the need, and fill my other 3, so 9. Yep.
Mr. McDowell?
As the labor shortage in county increases as we go by, if we were to change those positions to 35 to 40 hours and add 14% more to their gross pay at the end of the year, do you think that would entice applicants to go from 47 possibly to 54,000? Is that something we can do, one, to fill the gap, but to entice some of these people to come into the area and work?
I will answer it by saying this. Because we are down 3 clinicians right now, it has been offered to my current staff that if they would like to work an extra 5 hours a week, they can do that. I have not had anybody ask me to do that.
Well, any new hires could be hired at 40.
We could do that. We could definitely do that. It may.
Mr. Jackson?
Do you have any per diem workers that are available for the help you out, or is it strictly full-time people?
We do at the prescribing level, but not at the clinician level. That is something that is certainly something I'm open to and have done some advertising on, but have not gotten any takers.
Mr. Jackson?
Do you see any ideas to improve the situation? You paint a pretty dark picture right now.
It feels dark to me. So the assistant director and one of the staff members, the staff member who graduated from Albany State, are going down to like a work fair that Albany State is hosting, and we are trying to recruit interns, people that are graduating from their social worker program. That's going to happen Tuesday, tomorrow. And so we feel like if we can attract interns to our office, according to the individual that's going down, she said, man, if interns knew what you guys had here, they would assuredly want to stay. So again, we're bumping it up against that. There's more need for workers than there are workers. And I'll be frank with you, if you've got somebody who grew up in Albany, it's going to be a tough sell to get them to come and live in the Adirondacks and provide services here.
The reverse might be true also, Mr. Rogers.
Terry, now, is Clinton County also having issues filling jobs there as well?
Yes,
So it's not just, particular to Essex County?
yes.
And how do the salaries at BHSN compare to us? And we also have, which I know is a separate entity, the Mental Health Association, right? Here in Essex County.
Well, the Mental Health Association is not, it's not apples to apples.
So, I understand, but they have clinicians there to see people, correctly?
No.
No, they don't. Okay. So how's the salaries at BHSN compare to us and to Clinton County?
I really want what I'm about to say off the record.
That doesn't happen. You say it here, it's on the record.
Maybe we need to have this conversation in private?
I've heard that there are certain providers in our region who are calling up Clinton County mental health providers and offering them a higher salary and a sign-on bonus if they come and jump ship.
We should try that.
The other person.
I see in the Times Union, Sunday Times Union, and there's counties out there right now, I mean, the shortage is so bad, offering sign-on bonuses for a lot of different positions.
Yes.
I mean, we could probably sit here all day and ask for what we can and can't do to help you out. Maybe you could come up with some recommendations that maybe could help that out, get it back to us, and we could go over.
I think the salary situation could be a place to start.
That's the elephant in the
It's
room.
one option.
Well, your recommendation in that recommendation would be what we should probably start the salary at, maybe,
Okay.
other than just higher salary.
Right. Okay.
Yes.
Adjusting the salary, Terry, really means adjusting everyone's salary. Everyone.
You mean in
Not
the
just
county or or
all the other clinical people that you have.
right? Because if I adjust an incoming person, I gotta adjust everybody's.
Everybody has to go.
That's right.
Except for the 35 to 40 hour position.
Is that right? You're right.
You mean like the supervisors and the
Well,
administrators?
people that are currently working 35, if you hire new people at a 40-hour rate, you don't have to increase the other employees that are at 35. That's not true.
If I change the salary of psychiatric social worker, I've already got 6 staff members in my office with that job
So
title.
that's hourly rate.
Correct.
So they're working more hours to get that
Yes.
Other questions?
Sorry to be the bearer of bad.
Thanks, Terry.
Can't fix what you don't acknowledge. Okay, thank you.
Thank you, Terry.
Next up, public health, Linda Beers. Good morning, Linda.
I think you have in front of you a pretty robust report. I'm just going to call out a few things, and I do have some resolutions. So I'll go through the report first. I would on the first page like to point out that the governor's proposals for tobacco is in line, obviously, with what Essex County has already done, and we are well ahead of the curve. But I'd like to show you the trends of tobacco product among high school students. It's the bottom graph, which is challenging more, not to see in color, which I apologize, but the top line is blue, and that's any tobacco product, and the yellow one that spikes up just like this is e-cigarettes. So that's this page, and this is the first page of the report. So what we do in this report is each one of our units in the health department writes an article for you, so you get a comprehensive look at what Essex County Health Department is doing across the board. So cross-cutting themes is really my area. I write that every week, and I also do the legislative updates, every month. So in there are what happened at NISAC, quite honestly. As you're aware, I sit on the board for the mental health and public health. I'm the co-chair of that committee, and I sit on the early intervention preschool board. So it's really an opportunity to write resolutions and hope that they get passed. So I will point out that early intervention has a 5% increase for providers. So why? If you turn over, you'll see Luciana Salati gave you a really nice graph towards the back of your report, and it talks about children's services. Looks like this. And I will reiterate what Terry said. Our providers are all beginning to retire, and we are having a huge pitfall in speech pathologists, physical therapists. We don't hire these people directly in early intervention. They work for the state, the fiscal unit. And in preschool, they work for state ed. Something will have to happen as we move forward because we are really lacking the services to provide these for these children. So I want you to, on the tails of Terry's story, and also turn the page over and you can see the program activity. And these are each one of your townships. So the first bar, which is orange, is preschool. The second bar is early intervention. You would expect Mariah and big school districts to have them, but I think what you will see are some anomalies. You will see smaller schools with some significant children. These are delayed children that are showing up across the board. These numbers have increased, and again, we're having trouble meeting the needs of these kiddos because we are short services of speech, PTs, OTs. And I will also say to you, it can't be just money for us. There aren't enough. The Office of Professions shows a lack of this across the United States of America. I could double the salary potentially if there's nobody out in this area to do it. It's hard to, we can't do it. One of the things about early intervention is, though, it's a mandated service, right? It's mandated. We have little children that are born that need physical therapy, and we know that if we get them now, we will cure them or potentially solve their issues for life. It is imperative that we get physical therapy for these kiddos, and we are struggling. Again, this is not unique to me. This is a cry across the United, or certainly New York State. I'll just keep it at that. Then at NISAC, we brought that resolution through. So stay tuned. I also like to call out February was American Heart Month. Doesn't look as good, but this is probably the biggest turnout we've had with departments across the entire county showing up in red to show support the American Heart Association and the Heart Wear Heart. And I will say Bonnie Long won the Fitbit, so kudos to her. The next page I talk about public health accreditation. Just important dates there, April 3rd and April 4th. I believe the chairman of the board will appoint some people to be on this subcommittee. Our accreditation is extremely important to us, and we're having some folks, some of you will be on our accreditation board and be on site that day for the accreditation committee. And at the bottom, too, under family health, I would like to call out to date Essex County and case managing 9 elevated levels of lead. In the towns of Westport, Osable, Screw Lake, Mariah, and Tye, these are children with high lead levels. It's not like we don't have them, but we're calling them just to make you aware that we still have that issue going on. The Well-Fed Essex Collaborative is doing phenomenally. It is the collaborative to bring wholesome foods with our area farmers across the Essex County region. And that's on the other page. And communicable disease. We have pertussis in our schools, whooping cough, as you're aware. It's called that. And I will move quickly to I should number these. The next page, and I would call out the Essex County Heroin and Opioid Coalition was extremely well attended on January 18th, and we viewed a movie called The World Breaks Everyone, and afterwards, Many Are Strong at Broken Places. It was a video we viewed and had a lot of traction and potentially showing it in schools, and this talks about building resiliency amongst children that are damaged due to opioid or any substance use disorder, and not creating the cycle that perpetuates, right? To build resiliency in these kids that need it the most. And then last, because I cover children's services, is WIC. And today I will ask you for a resolution of appreciation, but I'm going to ask that we do the resolution of appreciation with a plaque at full board to Krista Berger and Susan Cutting. Susan Cutting and Krista Berger were asked and selected, and I mean selected. They were the only people in New York State. They were one of 9 people in the United States of America to go and speak to legislators about the importance of breastfeeding. I think that really is an amazing accomplishment. When they came here, the gentleman that came was like from New York City, and he was blown away by what we were accomplishing with such a small staff. That's how this happened. So with that in mind, not sure if you'd like me to read the resolution I wrote, or we should move it at full board. It's long, but okay. So I have a resolution of appreciation for the Essex County Health Department Women, Infants, and Children Coordinator, Kristen Berger and Susan Cutting, peer counselor. And it goes on to say, Kristen Berger, Essex County WIC Coordinator, and Susan Cutting, WIC peer counselor, certified lactation consultant, were selected to represent New York State. And we're one of only 5 WIC departments in the country to attend this meeting of new Congress in Washington, D.C. to promote the WIC Breastfeeding Peer Counseling Initiative. The Breastfeeding Peer Counseling Program of Essex County allows pregnant and nursing moms the chance to talk to Susan Cutting, a mother who shares the breastfeeding approaches and experiences and advises the family. She works non-traditional hours, so you can call her at like 8 o'clock at night, 2 in the morning maybe. She'll answer and she'll talk to these young moms. They met with Reverend Douglas Greenway, Director and CEO of the National WIC Association, Kristen Gillibrand, Elise Stefanik, Charles Schumer, Anthony Brindisi, and it goes on. It was a privilege to represent all of New York State's women who have made the choice to breastfeed their infants, remarked Susan Cutting. Everyone we spoke to was extremely supportive. Each year, approximately 50% of the infants are born to families qualifying for WIC. That's in Essex County. It's actually 53%. Since the start of peer counseling programs in Essex County, breastfeeding rates have increased from 55 to 81%. That's huge, right? This one woman who gets on the phone when mom's ready to quit says, no, I can talk you through this. So 55 to 81%. With no OBs in our county at all, there doesn't exist one in our county, this program is vital. Research states that mothers that breastfeed have a lower risk of developing breast cancer, ovarian cancer, heart disease, stroke, type 2 diabetes, and postpartum depression. And the longer a woman breastfeeds in their lifetime, the more protection she receives. Babies that are breastfed have a lower risk of infection from common childhood illnesses, including ear infections, respiratory infections, as well as reducing obesity. So I'm very, very proud of them, and I would ask that you write a resolution or approve a resolution of appreciation.
An endorsement of this resolution by Mr. Politi and a second by Mr. Giordano. Questions, concerns? All those in favor?
Aye.
Opposed? Carried.
I should also point out Sue Cutting is from Crown Point. Now I have another resolution. It is to accept workforce training funds. This is district money. We went to a training and we asked them to pay for it, and they did. So we got $1,358, and we need a resolution to bring in the funds so I can expend them.
Endorsement of this resolution by Mr. Scott Spava and a second by Mr. Merrihew. Questions, concerns? There being none, all those in favor?
Aye.
Opposed? Carried.
We also applied for workforce training funds to send our fiscal managers to a retreat in the Adirondack Health Institute through Disney. It was $3,671.25. We would never have gone if we didn't get approved and have this money. It was a phenomenal opportunity, and anybody like Terry or whatever working on value-based payment, it is imperative that we keep our folks trained on the new trends, or we will lose money, because this is an unprecedented time in healthcare where it changes every day on how to bill. It's absolutely amazing, and if you're not on the cusp of it and you're not listening closely, one wrong slip-up could cost you significant loss in billing. So it was really a great opportunity. So that's my resolution.
The endorsement of this resolution by Mr. Merrihew and a second by Mr. Giordano. Concerns? There being none, all those in favor?
Aye.
Opposed? Carried. Anything else today?
No.
Thank you very much.
Thank you.
Excuse me, wait. Mr. Jackson.
Being an old drunk, you mentioned briefly the 21 smoking. I've heard different things up and down about the state's mad rush to approve recreational marijuana. I heard that they were going to include something to make it 21. I've heard they aren't going to bother. You're closer to the source than I am. What's the latest you're hearing now?
So we were in meeting NICEHO, and I sit on the executive board for NICEHO. We were in front of legislators on Tuesday in Albany. There is the public health department as well as New York State sheriffs and everybody. We have come out in opposition to, and I'm going to tell you that the last time I will never say. So recreation is bike riding, riding your car, bike riding, exercising, because not smoking weed. So we are calling it adult use marijuana smoking, so versus the recreation portion of it. So the adult use marijuana, the New York State Health Department is strongly recommending that when tobacco 21 goes up, it also gets tied to that. We're really advocating that the funding equally come to the health departments that will be tasked with doing all the messaging, right? Who should smoke marijuana? Moms that are pregnant shouldn't smoke marijuana, because these things need to be said, because we've never had it. So you can't assume that anybody would know it. So that is a big push. The other question is, who's going to regulate this? So is it going to be the ATUPA grant, the people that regulate tobacco, which in our county we're not full service, but it is the health department that does that? Or there's the liquor licensed people, the people who will regulate wine and liquor, which is a whole different organization. That is still up for grabs. In last month's report, I wrote a whole initiative about what's going on, and in this one, equally under legislative updates, I clue it in to talk about the marijuana program as well. So NICEHO, which is my association, New York State Association of County Health Officials, it's just the Ms of every county, have gotten together. We've met repeatedly with the legislators and whatnot, saying, listen, if this is coming, we understand it's the course is out of the gate, but these are things you must assure. We must assure them. And Colorado and a lot of counties or states that have done it already see the significance. It's not that it shouldn't be done necessarily, it's that we can do it better. And it's our hope, and that we roll out this slowly with thought and with things in place before we make it available without the proper infrastructure. So.
Any questions concerning this topic? Thanks.
Thank you.
Office for the Aging, Chrissy Lurkins.
Good morning, everybody.
Good morning.
In my report, I just want to highlight a few things. The first is last month when I was here, we talked about the NYSOFA, New York State Office for the Aging Pet, companion pet pilot project that we were engaged in. So our companion pets, 2 cats and 2 dogs, arrived a few days after our meeting last month. To date, we have 3 adopted out. A few pictures in the front page. So far, so good. We've received a lot of really great feedback of how comforting the folks that have adopted these pets out. You'll see in the top, Mickey, one of the silver cats that we had, definitely won her owner's heart and landed on the kitchen table that afternoon and slept well that night, so she's loving life. The next page calls out the date of March 22nd. March 22nd of 1974, the nutrition program, so the home delivered meals, the congregate site program was implemented under the Older Americans Act. So March 22nd of this year, the New York State Office for the Aging is trying to do a statewide campaign called March for Meals. So on this date, we are offering the invite to local elected officials to join us, whether you want to ride on one of our home delivered meal routes through with ACAP, whether you'd like to come to one of our sites and help prep the meal, help serve the meal, just kind of gain more hands-on perspective about the program and celebrate the program. We know that this is a very costly program to the county, to the state, to the federal government, but we also know that it's not only a balanced meal that these folks are receiving, it's eyes and ears on these individuals every single day. If there is something out of sorts with one of our clients, the drivers are trained to contact us We call those clients, we call the caregivers to make sure that, we're catching things ahead of time. We're preparing for a snowstorm the next couple of days. Our staff will reach out to all of our home delivered meal folks, make sure that they have enough food on hand, enough water, enough medication, they have enough fuel oil, heating. If they don't, then we're going to be prepared for that ahead of time. So if anybody is interested in, taking part in that campaign, give me a call, shoot me an email, and we will arrange whatever fits your schedule. Next couple of pages, just some statistics about the home delivered meal program since it was implemented across the state. We also, last year, we were part of another NYSOFA pilot program for the Aging Mastery Program. We received funding to implement that program, so we have 2 staff that are trained. We're going to roll out that program in, March, down in Ticonderoga at our nutrition site. So feel free to spread the word on that. And then the last few pages about the changes to Medicare now in 2019, as well as the last page of the report talks about the free tax preparation, the volunteer income tax assistance program. So individuals that meet income guidelines can go to a certified tax preparer and have their taxes done free of charge. On that page, you'll see the sites for Clinton County, as well as the few here that we have in Essex County. A lot of our folks go to the Plattsburgh sites. I do have a few resolutions. The first is authorizing the appointment of Amanda Wisher, the Primary Care Data Quality Specialist from the University of Vermont Healthcare Network of Elizabethtown Community Hospital, to the Essex County Office for the Aging Advisory Council for a 3-year term, starting March 1st, 2019, and ending February 28, 2022.
Endorsement of this resolution by Mr. Monty and a second by Mr. Jackson. Questions? All those in favor?
Aye.
Opposed? Carried.
Next one is authorizing the slate of officers for the Essex County Office for the Aging Advisory Council as voted on and approved by the Council at the January 17, 2019 meeting. President would be Lynn Edmonds, Vice President Elizabeth Weiss, Secretary Susie Dubay.
Endorsement by Mr. Giordano and a second by Mr. Monty. Questions, concerns? All those in favor?
Aye.
Opposed? Carried.
Okay. Next is, I believe back in maybe July, August, September time, I came to the board and talked about a collaborative that we're asked to be a part of with UAlbany School of Public Health for one of their grant proposals. We're still awaiting answer on that. We should receive something in maybe August, September. In the time since we submitted that application, there has been another opportunity to kind of just fill the gap if we are not awarded that. So again, we'd be partnering with Albany School of Public Health, with Franklin County Office for the Aging, and ourselves as the original subrecipients. But we want to look at more of the North Country. So now we are looking to be a subrecipient with Franklin County, UAlbany School of Public Health, as well as adding Clinton County Office for the Aging and St. Lawrence County Office for the Aging, to kind of, again, just take a look at how the home delivered meal program impacts social isolation of those individuals that are receiving the meals. So this authorization gives us permission to be a subrecipient, and if awarded, we would receive $20,000 over a 2-year time frame.
Endorsement by Mr. Monty and a second, please. By Mr. Scarsfala. Questions? All those in favor?
Aye.
Opposed? Carried.
Okay. And then I do have a last resolution that I put on your desks this morning. This came to fruition on Friday. I had a brief conversation with Mr. Palmer in regards to this. In the executive budget this year, there's an additional $15 million that would be awarded to New York State Office for the Aging, then would be turned out to the counties to fill the unmet needs. So this could be individuals that we're not serving yet. These are individuals that are on waiting lists. There is some potential of some kickback from some advocacy groups. So we just want to make sure that Our local elected officials as well as our state folks know how important this money is. So this $15 million, if it's kept in the budget, would then in turn save at least $34 million, especially Medicaid dollars, for it being able to put services in the home, keeping individuals out of the nursing home, out of the emergency room, out of long hospital stays. I've talked over the last couple of months about our ISA program. We have a lady on there right now that she's going to be turning 103 very soon. We have some aid time in there and a lifeline. She would easily score to be in the nursing home. She's been on service for many years. We've kept her out of the nursing home, out of the hospital, therefore saving a lot of money. There is no county match as written in the budget at this time. This $15 million is additional money. It's not coming out of any other agency's line item or budget. There is a plan with this money that is a reoccurring appropriation to maintain service, because we're going to put $15 million out there to meet the unmet need. What's going to happen next year if we don't actually have that money coming in? The association I belong to has been very active with seeking other support from other agencies, other not-for-profits, other health insurance companies. They have very strong support right now from AARP, Live-On, Lifespan, NISAC. So we wanted to, every county is tasked with going to their board to pass a resolution of support for this money. You have that in front of you. Do I need to read it or no? So I just asked Franklin County passed the same resolution last Thursday. I believe Clinton's right behind us. So.
The endorsement of this resolution by Mr. Monte, and a second, please. By Mr. Jackson. Questions, concerns? All in favor?
Aye.
Opposed? Carried. Thank you very much, Kristen.
Thank you.
Anything else to come before Human Services? Mike?
You need Chrissy? I just wanted to have Chrissy pass it on to compliment the people who prepare the food at the Westport Center and the school like Elsie, or
Keisha.
Keisha.
Yep.
Keisha. I've eaten there several times, and they do a great job of, even though it's institutional style cooking, it's still very good food.
Yeah, we get a lot of good
Sure.
feedback. We get a lot of good feedback. We also get some of the negative feedback, so we just have to take that negative feedback and turn it into positive. They're preparing hundreds and hundreds of meals, so it's not going to be very, not potentially, no, because there's a lot of dietary restrictions that they have to follow. They're doing their best. They're doing a lot of more homemade products versus many years ago, the prefab stuff. But trying to meet the needs of hundreds of people every single day is not easy, but I feel like they're definitely doing a great job and improving every day. So thank you. I'll pass it on. Anything else?
Any other comments? We are adjourned.